There are new vaccination requirements for Hawaii students heading into the next school year. The new rules apply to students entering childcare or preschool, kindergarten, 7th grade, college, and any student entering school in Hawaii for the first time, no matter what age. How do parents prepare their children to meet these new rules? Are there exemptions? Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Yenji Denise. Hawaii students from kindergarten to college are required to be immunized against numerous diseases before they start school. Vaccinations include measles, chickenpox, polio, hepatitis A and B, diphtheria, and others. New for 7th graders next school year is a vaccine against HPV, or the human papillomavirus. Student parents can choose not to vaccinate their child based on medical and religious reasons, and many parents do opt out. Health Department statistics show that charter schools had the highest percentage of unvaccinated students at 8%, including one school on Kauai that was nearly 40%. Tonight's guests include the state health director, a public health expert, a high school student, and a state lawmaker. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and on the PBS Hawaii Facebook page. Now to our guests. Bruce Anderson is the state health director overseeing more than 100 programs and 2,700 employees. As director, he is the chief health and environmental official in Hawaii. Representative Bob McDermott is the assistant minority leader representing District 40 in the State House of Representatives, including Eva Beach, and Iroquois Point in West Oahu. May Rose Dela Cruz is an assistant researcher at UH, where she earned a doctorate in public health and has recently been involved in research on HPV vaccinations among ethnic groups here in Hawaii. And Lyra Panrigan is a senior at Moanalua High School. She's the editor-in-chief of her school newspaper and an aspiring journalist. Welcome to all of you. Thank you for being here tonight. I know you've been quite busy and we appreciate your time. I want to start first with how this rule came into effect, because I think a lot of people would be interested in that. This is not something that went through the legislature. This goes directly through your department.
Back in the 1960s, the legislature gave us authority to develop rules, as in most states, to require vaccination in schools. And since then, we've been vaccinating kids, as have other schools. The last time we updated our rules was back in 2001. So there was a long time between rule changes. We just went through a process of public hearings and revised our vaccine schedules and added several new vaccines that had been developed since the last rule change. Those rules became effective. The governor signed the rules less than a year ago. Those changes become effective this summer in July, and call for a new suite of requirements as it relates to school vaccination.
And why did you think it was important to include HPV in the changes?
Well, first of all, that's highly recommended by agencies who have studied this issue. HPV is a virus which is sexually transmitted mostly, but it's also transmitted through other means. It does cause cervical cancer in women and about 5 other cancers. So it's a serious health problem. Most young adults, men and women, have been exposed to HPV. So if we can prevent them from becoming infected early in life, then the chances of them developing these cancers it has been demonstrated to be much lower for those individuals.
Tell us a little bit about your research and about what the different perceptions among ethnic groups in Hawaii is toward this particular vaccine.
Sure. So I've done 7 surveys statewide regarding the HPV vaccine, and my populations are normally Native Hawaiians, Pacific Islanders, and Filipinos. Native Hawaiians and Filipinos have the tendency not to vaccinate if they don't have enough information. So also they are the populations that have the worst cancer outcomes. So I worked with Imihali Native Hawaiian Cancer Network, a program of Papa'ololakahi, and we looked at cancer prevention research. So what we did was we surveyed parents, providers, and pharmacists on the HPV vaccine. And doctors are in support of the vaccine, so are parents. So even going back to 2008, parents were very supportive of the vaccine and vaccinating their daughters at that time. And we actually asked them a question: if the school system required the vaccine, are you most likely to vaccinate your daughters? And they said yes, way over 50%. If it wasn't a requirement, it was below 50%. So they just needed that added push to have that school requirement.
Representative McDermott, what are your concerns with requiring this for entry into public schools, or all schools rather?
So the average person on the street doesn't know what HPV is. You ask them, what's HPV? They have no clue. It's genital warts, right? That's what it is. Girls are highly more susceptible to getting it, right, than boys are. Yet you see commercials on TV, get your, the young boy saying, I wish I would have got my HPV vaccine. It's because the female cervix is not fully mature till they're about age 19. And so they're much more susceptible to infection. Even if their partner has a condom on, they can still get HPV from their partner, because as I think Bruce said, there's other ways to transmit through your fingers or whatever. And so parents don't know that this is primarily transmitted through sexual activity. So then you say, okay, these are sexually related warts, and we're giving the vaccines to 11-year-olds. Now, if you phrase it in that context, you're going to have a lot of people show up at the public hearings. I don't know where the public hearings were held, and I'm a lawmaker. I have a lot going on, of course, but if you frame it in that context, parents will show up in droves and say, keep this away from my kids, because I don't want my 13 or 14-year-old child being active. Now, they may be active, right, unbeknownst to the parents, but the parents want them to try and wait to delay sexual activity. And the parents, for lack of better words, control the children until they're 18. So it's the parents' call. If the parents don't feed that child, we hold the parents responsible. If the parents don't clothe that child, we hold the parents responsible. Same thing with medical care. It's up to the parent to make the decision. And we are seeing a disempowering, sorry, I feel like a politician on filibuster here. Sorry, Bruce. We're seeing a disempowering of parental rights across the boards. I see it down at the legislature all the time. They can get treatment without parental consent. All the time, these bills come in front of us. In fact, the HPV, as we spoke about earlier, has come before the legislature to mandate it year after year after year. And even my colleagues down there have had the good sense not to force that on the parents. Now, I'll get off the soapbox.
Lyra, as a student, what's your take on this?
Definitely, I've asked a lot of students, and as well as for myself, I firmly believe that it's important to prevent these diseases from happening to other students, and I feel like that it's a good thing to prevent it at a young age. I get the point of, we don't want to encourage young kids to get into sexual activity, but I also feel that it's important to get them vaccinated before anything happens, because of course the parents don't know anything. So I feel like that's important for us as students to know that if anything happens, given the circumstances, that we're protected by certain diseases.
Well, that's a great point. Let's talk about the age. Why this young?
Well, first of all, the vaccine is more effective if it's given early, and people have several years to build up the immunity that would occur. Probably many more older teenagers have sexual activity than young teenagers, but it's important that a person be vaccinated early on so that the vaccine is effective later in life when they probably are going to be more active sexually. And as I mentioned earlier, there are other ways of getting HPV
Well, Bruce, can
infections.
you share what they are aside from intimate sexual activity?
Any intimate contact.
So intimate sexual activity.
Not necessarily sexual even.
How,
It's mostly skin-to-skin contact, so it's very innocuous. 80% of the population has had the HPV virus at some point in their life, and there's 14 million new incidences a year.
how many strains are there of
There's
HPV?
over 100.
Okay.
100 strains, and you say
Yeah.
80%.
Right, so,
It's a
but it's so
cold sore, right?
innocuous.
I mean, one of them is a cold sore?
No, it's very asymptomatic, so you actually don't know when you have the virus, and you can pass it on partner to partner. The time when you experience symptoms is when you have genital warts or you exhibit precancerous cells, abnormal pap smear. But regarding your comments about Representative McDermott about the parents not knowing, so I've surveyed over 1,000 parents, multiple surveys, and 80% do know about the HPV vaccine.
They know that it's genital warts.
They know that they know about the vaccine, that it prevents cancer. They know that 90% produces genital warts, and then they also know that now it's produces anal oropharyngeal cancer. But the reason why they're not vaccinating is because doctors were not giving strong recommendations. So
let me emphasize that this vaccine wasn't even available last time we did our rulemaking. It was only recently made available to the U.S. public, and people are still learning more about it. And I expect that will continue as we go on. I think the numbers are more like 90% of males, if they're not vaccinated, are infected, and most of them don't know it. In fact, very few of them actually know that they are, and those people can transmit the disease through their entire life. So it's something you want to be sure people are protected against early in life. The argument is primarily that it encourages sexual promiscuity, and that may or may not be true. I like to believe it's probably not true. People will engage in sex whether or not they feel protected in this way. But having said that, that seems to be the most controversial part of the HPV vaccine. And that's what we heard in our comments when we were going out to public hearing. People are just generally opposed to the idea of a 7th grader, 11-year-old being protected against a sexually transmitted disease. Again,
mandated by the state.
Mandated by the state, except if you have an exemption. And again, there are exemption options for people who feel very strongly that this is something they don't want to have. Most people welcome it and want to protect their child throughout their teenage years and later. So the overwhelming consensus was supportive of this, but there were many others who, besides Rep. McDermott, who expressed concern about the time frames in introducing this. It is recommended nationally that 7th graders get this vaccine. There's only 1 or 2 other states that actually require it now, simply because it is new. It's always controversial every time it's proposed for the same reasons.
How many strains? You said there was 1,000 strains?
100 strains.
100 strains. How many strains does the vaccine affect?
There's 9. So there's Gardasil 9, but it covers 16 and 18, which causes cervical cancer. But if you look at the vaccine, it also covers oral, anal, vaginal cancers. So when parents say, oh, my child is already sexually active, I shouldn't give him or her the vaccine, I like to say, well, this is a good time for you to give the vaccine because you don't know what strain they have. They could actually have another strain that is not covered by the vaccine, so it's better to have it now. And regarding mandates, it's really important that we have that mandate because it's not only the HPV vaccine, but we have Tdap and meningococcal. It reaches the populations that don't normally have access to vaccinations, and it actually pushes the doctors a little bit more to go beyond the stigma that it's an STD-caused virus. It's a lot of our preconceptions are from doctors saying, oh, I'm not going to push for the HPV vaccine because I don't want to have the sex talk. It's really important that the doctors are also on board so that they know that that's not the narrative. The important narrative is it prevents cancer.
What age does cervical cancer usually hit? About 50, right? That's the peak?
Well, it gets younger and younger now.
So you're saying it's a moving target?
No, it's not.
Okay. The other thing is HPV hasn't been tested against the cocktail of the other 72 immunizations that a child gets now by the time they get 18. I'm talking about from birth, DPP, polio, mumps, rubella. Has that been tested in conjunction with all those other vaccines? And what is the results, harm or no harm? And how long was the study? So this is what you guys do for a living. It's not what I do for a living.
Well, actually, the vaccine has been around for over 10 years, and because of its controversial nature, it is the most widely tested vaccine. Many tests has been ran against it. And so that's why we went from 3 doses to 2 doses for certain ages. But it does have side effects. But many of the pediatricians would give it with another vaccine, whether it's Tdap or with influenza. And there's no huge contraindications.
What is Tdap?
Tdap is diphtheria.
Okay.
One thing I'd jump in on here is, I don't know that there's anything that's studied more carefully than vaccines. They take years and years to develop right off the bat, and they're constantly reevaluated year after year after year.
Bruce,
Every scientific body that I know supports this.
And personally
Let me just ask you this. Given that there are mechanisms to opt out, isn't that enough?
For me, it is. But I want to go back to something before I lose my train of thought. You said they're the most medically studied. I beg to differ with you, sir. They don't go through double-blind placebo tests like a heart medicine would go through. They are not considered medicine. They're considered biologicals, correct?
They're considered vaccines, and all vaccines have to go through a very rigorous testing procedure. It takes years to develop a vaccine.
You didn't answer my question.
Well, what do we categorize it? Is it biological or?
A blood pressure medicine gets more testing than a vaccine. There's no liability for vaccine manufacturers, none. 1986, Congress passed immunity, right? So there's no liability. So if my daughter takes it, and the next day she develops some sort of autoimmune disorder, I'm going to go into the doc and say it was the vaccine. He's going to say, no, it wasn't. How do I prove it? How do I get compensation for that?
For research-wise, like how often does it become that serious where it reaches to that extreme of that side effect?
So there's always risks when you have medicines or vaccines. There's always adverse effects, like, oh, that shot hurt, or there's syncope, some people faint. And, nothing is 100%, proven, no risk-free, including vaccines. So I think when you talk about having these adverse reactions, by law, they have to take note of that. So especially when doctors say, you're getting the HPV vaccine shot today, and he's already, triggering that point, like it's gonna hurt. So of course, parents and the youth might be already like, oh my gosh, it's gonna hurt, so I'm gonna be really scared, and they tend to faint.
Yeah.
So it's just instilling that fear already before you're giving the shot.
You're going to hear, of course, about people who have had adverse reactions. It does happen. When you approve a vaccine, you're weighing the risks against the benefits. And most of the vaccines prevent tens of thousands of deaths or illnesses that would otherwise occur if you didn't have the vaccine. So you may have 1 or 2 serious reactions in addition to the sore arm when you get a vaccine. But for a risk manager, you have to weigh those benefits and risks. Great case is the measles. We had an outbreak of measles earlier last year now, in Samoa. Measles is a very preventable disease if you're vaccinated. 99% of the people who are vaccinated won't get the measles. In Samoa, they had a problem, a crazy situation where a nurse gave 2 kids the vaccine who subsequently died from the vaccine because it was improperly formulated. And people stopped vaccinating themselves. There were rumors were out there that vaccines were dangerous. It was a stupid mistake. They put an anesthetic into the vaccine formulation and killed the kids. But as a result, 30% of the people, the young kids in Samoa, were unvaccinated. What happened then is measles came into the community, went like wildfire through the community, and 60 kids died just in the course of about a month. That's just in Samoa. This same thing happened, and of course that measles outbreak extended into New Zealand and many other countries where dozens of other kids died. Just as an example of the fact that these vaccine preventable diseases do occur. You've got to keep the vaccine rates up high. And yes, there are occasionally problems with the vaccine. That's why we have a medical exemption, is that sometimes people do react to the serum and the vaccine or some other reason. They may be medical reasons not to do that, and you try to reduce the risks using that medical exemption. But any risk manager, any person who is looking at medications or others realizes there is almost always an adverse effect from something, And again, you're weighing the adverse against the benefits. And with vaccines across the board, managers have determined the benefits outweigh the risks, given that these things have been well studied. Let me say one other thing about comparing it to a drug. You know, you approve a blood pressure medication. It's approved, you can use it forever. One thing about vaccines is they are constantly reevaluated and reformulated if necessary. Every year they're reviewed and improved. One of the reasons why we're changing our vaccine schedules is because they've come up with better schedules that make the vaccine more effective. And they change the vaccine. Flu vaccine is the greatest example I can think of. Every year it's different. It's tailored to meet the needs of that particular year. So there are huge differences between vaccines and drugs and other things. And there's no question in my mind that they do cause adverse impacts. I would give any anti-vaxxer that benefit, and it's true. But when you think about the benefits of vaccine, it's overwhelming.
I want to bring in some of the viewers on this. And Representative McDermott, one caller writes in, parents who do not vaccinate their kids should sign a liability waiver. I think there is that concern that, you know, if your kid is not vaccinated, that you are putting others at risk.
I suppose that's a good question, but I'm not talking about all vaccinations. I mean, I'm not going to say don't get the polio vaccine. We started talking about HPV. By the way, these guys are both smarter than me, and this is what they do for a living. I'm not a scientist. Okay?
But you do speak for a number of people who do have these concerns, especially parents and those who have. Exactly.
And my daughters both got the HPV vaccine. That's a decision that my wife made with them, right? But my wife made that decision. She knows what it is, okay? A lot of people don't. And what I don't like is the mandatory part of it. You know, Bruce, I can't figure out why we mandate kids get the hepatitis vaccine at 1 day old, 2 days old. Unless they're with a seasoned prostitute or scrubbing rusty barnacles off a ship, there's no need for it. So we're introducing, and also there comes a point where when Bruce and I were kids, we got 3 vaccinations, right? There was 3, 1962, 61, 59.
Polio.
Yeah, we got 3. Today, by the time the kid gets to be 19, they get pinpricked 72 times. And these agents, there have been no conclusive studies done on the cumulative effect of all of these agents together and how they interact. The National Academy of Science and Engineering was commissioned by CDC 4 times to do it, and they couldn't come up with any affirmative or negative answer. They said, we don't know. 4 times. Now, they can cite studies. This isn't what I do for a living, but I have a concern, and the concern is mandating this one. And this one is primarily based for sexual activity. And when we were at the Ledge, it was always Planned Parenthood pushing this, and the LBGT caucus, and the people who were so focused on sex were pushing this, and that's why it never passed, because the folks said, hey, this is up to parents.
I was part of that. I mean,
I didn't see
but
it.
Because I wasn't part of Planned Parenthood. But there were many of us there, providers, the Hawaii Immunization Coalitions, even doctors and, you know, people of the community, Native Hawaiian organizations and other reps. But regarding the mandates, let me talk about Australia. So Australia started pushing for the HPV vaccine to be pushed at schools. It was a requirement in 2009 for girls and 2013 for boys. Now, if you look at their cervical cancer rates, it's down, you know, it's the reduction of cervical cancer is down to 75%. It was down 75%, and genital warts is nearly gone, down to 90%. So there's a huge reduction of these HPV causing diseases. And that is a testament of how the vaccine works and how the school mandate helped the population of Australia. So, and I was born in the Philippines. So I got measles, mumps, chickenpox, and I didn't have access to healthcare in my province, no doctors, no clinics. And I suffered. You know, my mom would tell the story of how I got pneumonia when I got mumps, and I nearly died. And when we moved here, I got chickenpox again in my sophomore year of high school here, and it was horrible. I don't remember what happened in the Philippines, but I can tell you what happened when I had chickenpox again. I was tormented as a student, And I was also, my parents, I was isolated from the community. So I think we take for granted sometimes that we have that luxury of the extra protection when other communities don't have that. So I think we have to consider that too.
I want to give Lyra a chance to jump in here.
I think for me personally, when you guys came into talking about how, it's the parent's decision, it's the parent's choice, I feel that opening that HPV vaccine to those 7th graders and, that doctor having that talk about them, about sexual transmitted, because I got my HPV vaccine when I was in 7th grade. And for me, I was just thought, okay, I'm just gonna get another shot, it's no big deal. But then afterwards, my parents, kind of gave me that talk. And I feel that talk about having those sexual activities and, although they're allowing me to get that vaccine, that's not them saying, oh, go ahead, go engage in sexual activity. No, that's not what they're saying. And I feel that opens another area for parents to talk to their kids about sexual activity and how it's best recommended to wait or not even have it at all at that age. So I feel that being that it's mandatory, it opens that conversation with the parents and with the doctor too. So.
Could there be a benefit to opening that discussion?
Yeah, so it's three against one. And 2 smart ones and a bright young lady.
I mean, I don't know.
But I mean,
Yeah,
maybe that is an opportunity
parents
to
gotta be
have that
parents.
discussion, and is that necessarily a bad thing?
No, it's not. It's parents, it's a good thing. And I'm not saying vaccines don't work. I mean, I've had them all, and I've even got extras, because when I went to Desert Storm, they gave me extra vaccinations for like the nerve gas and stuff. Now, I don't know if there were side effects, but before I left, I looked like George Clooney. And now look Bruce, look at the side effects. This is what happens. But I do believe they work. But my concern is mandating more and more and more. And we really, I mean, we haven't done there's no definitive cumulative study. And the transmission, what do they call those, Bruce? The adjuvants? The adjuvants that they wrap the live virus in, we wrap it in formaldehyde and mercury and other things, and aluminum that we put into our bodies. I don't know if they still use the mercury. I don't think so.
There are sometimes traces of other substances in vaccines, but not at levels that cause any harm. There are elements that you typically find in people anyway, and certainly that's been carefully studied, so that I really don't worry about any constituents in vaccines. Again, they've all been carefully evaluated through extensive trials and studied, and sometimes reformulated. If they find something that is causing a problem, they'll reformulate it and make it better. So I think there's an evolution of any vaccine over time, and they do get better and better and better.
Let me ask you both a question. Am I wrong? You'll tell me yes. Has there been any cumulative study that you know of that takes all the vaccines from when we were born, newborn, the DPP, mumps, rubella, all that, to what now this new batch going to come? Well, you couldn't study a new batch yet because it's not implemented, but you're going to have a new batch of vaccines. You're going to get, the kid's going to get pinpricked 70 to 80 times by the time they're 19. Has there been any studies on the safety of all those cocktails mixed together in one human body?
The best study is just look at the human condition in the United States, where people have been vaccinated with multiple vaccines for a long time, and those are evaluated. Remember that you've had many vaccines, right? And as have everyone else in the United States. If there was a cumulative problem, it would have been identified as we've gone forward with this. We have not seen any evidence of any synergistic or other problem that could be attributed to multiple vaccines being given. They typically act independently. There's no biological reason to think that they would interact with each other. So fortunately, we haven't seen that.
Okay, well, let's get to some more of these viewer questions. Christina via email says, what are pro-vaccination parents who want to opt out of the controversial HPV vaccine supposed to do if there's no way to opt out of just one vaccine? So let's say you have you don't have an opposition to, like Representative McDermott, you're okay with polio, but you're not okay with HPV. Can you cherry pick which vaccines to be exempted from?
Yeah. Well, Lyra, for example, mentioned she was vaccinated with HPV on her own. I mean, frankly, most of these vaccines, good pediatricians are recommending anyway. We're really just doing what best practices are for for the country, and they all do the same things. But if someone for some reason didn't want to have a vaccine, there's always the religious exemption or a medical reason. I mean, again, there may be good legitimate medical reasons why you wouldn't want to have it. The religious exemption is probably abused in some cases. 90+ percent of the population here recognizes the benefit of vaccines. We don't see this very often. But if someone for some reason has a strong objection to it, they could get an exemption. That exempts them from essentially every vaccine that we offer. It's essentially a philosophical exemption. And then they can opt into vaccinating as they would any other vaccine. You don't have to be mandated to have a vaccine in order to have a vaccine. You can go to any pediatrician and they'll recommend you be vaccinated, and they can vaccinate you with whatever you want. The difference is in schools, as a condition of admission to all schools, not just public, it's private schools and the university, they have to meet that vaccine requirement in order to be admitted into the school.
Sorry, Dr. Anderson. Yeah. So you have some time. So even if you don't get vaccinated in the school, or your parents chose not to vaccinate you get until you're 26 to be vaccinated. So regarding missed opportunities, not talking to your child about sex, I talked to a parent and she told me the case of her twins, a boy and a girl, a son and a daughter, and she told me, well, I'm going to give them the opportunity to decide when they turn 18. So when they both went off to college, the mom said, don't forget to get your HPV vaccine. I think you should get it. And the daughter said yes. She got it at her college clinic. The son, however, was like, why should I? Why would I want to go get a shot in a clinic at college? I don't want to, Mom. If it was so important, why didn't you send me in to get vaccinated? So it's a missed opportunity too. When you say your child has to decide or has an opportunity to decide when they're 18, they might not choose that opportunity. But you have till you're 26 to have coverage. And now with FDA regulations and support, you got till you're 45 years old.
Let me add one more thing. This hasn't been said yet. When you're vaccinated, you're not only vaccinating yourself, protecting yourself from a disease, you're protecting other people too.
Right.
And that's critically important. If you have a situation where people aren't vaccinated, honestly, I don't worry about the person who's not vaccinated as much as I do that person may transmit the disease to lots of other people. So it's critically important you maintain a vaccine prevalence in a community to prevent the spread of disease to others. So not getting a vaccine is in many ways selfish. You're thinking you're protecting, you don't need it. But it may not be you that really is important. You may be transmitting that disease to someone else. And that's also very important. And we have to remind people sometimes you're not just protecting your child, you're protecting every other child in that person may come into contact with. So it's important from that standpoint.
Lyra, what about that idea of personal responsibility?
Well, I feel like I've asked around from my friends personally, and I was like, hey, can I get your opinion on how you feel about HPV and it being mandatory? And they were talking about herd immunity, and they were like, oh yeah, if one person gets vaccinated and more people that get vaccinated, the less possible it is for that disease to happen. But one of the concerns that I've got from asking a parent was like, something along the lines of, if you do get, that vaccine and stuff, and if it does become mandatory, what about the people that can't really afford it? Is the schools going to be the ones that are, administering that mandatory vaccine, or do they have to go to, their own pediatricians? It's kind of like the flu shot, basically, because I do know that they have that flu shot program where you can get your flu shots at school. For mandatory vaccines, their question is if that has to be at school as well.
Yeah. First of all, with regard to the cost, every health plan covers these vaccines. So there shouldn't be a cost if you have any type of health insurance. And there's even a fund that can be tapped if you don't have health insurance to cover the vaccination schedule. That shouldn't be an obstacle. The hassle factor is legitimate. It is a hassle possibly to go to a doctor's office or a clinic to get a vaccine. But having said that, it's a good idea to do that anyway. Typically you're doing a physical or getting evaluated for other things at the same time. So it's a good thing to have at certain points in your life. And school is the place to do it. that's where you have, the most opportunity to make the most difference in a person's life going forward and in the community.
Representative McDermott, I'd love your response to this. The state has attempted to control our families. That is absurd. If they force this on our kids, it could result in our kids being sterile. If this happens, I will stop paying taxes. I mean, I'm sure you would take issue with the idea that this would make you sterile, obviously, but the idea that the state is attempting to control families, is that what you hear from your constituents?
I go back to before, I see parental rights eroding every year at the legislature. This year there was a bill to allow unlicensed medical practitioners who practice under a supervision of a licensed practitioner to treat children without parental supervision, without the parents' permission. And I see this all the time, and it comes from all corners. So you have the eroding of parental rights, and this is part of it. I see the mandatory vaccination of not the rubella or polio or rumps, but the primarily transmitted through sexual activity vaccine, HPV. I must take issue with you. Everybody I've talked to, and it's anecdotal, they never know what HPV was. I didn't know what it was till about 5-6 years ago when I got involved with Pono Choices. I said, oh, well, why don't we just call it genital warts? Because that's what it is.
Right? Other things besides warts.
Right. Yeah, well, there's 100 strains, you said.
Yeah, and it causes other problems besides warts. That's one manifestation of HPV.
Right, but so to come all the way back to the question, are we taking away parental rights? We are to a degree. We're mandating this. Now, Bruce said there's a religious exemption, so if you don't want it, you just tell them, I don't believe in it, and you don't have to get it. And that's the way around it, until we come in and say there's no religious exemption, which we could do. And then there will be a court case go to U.S. Supreme Court because you have the freedom of religious expression, not freedom of worship, freedom of religious expression. And if your expression is not to vaccinate my child for this HPV, which is primarily transmitted through sexual activity, that's your decision.
Well, and on that point, on Tuesday, on Super Tuesday, voters in Maine actually upheld a state law that was passed by the legislature that said that basically nixed religious exemption. We'll see if that is contested in a higher court, and said that only medical exemptions would be approved. No no religious exemption. What's your take on that?
I disagree. If we have freedom of religious expression, that's guaranteed in the Constitution. Now, not if it's going to make him sick. I don't have the right to come in with a hoop and cough all over Bruce. That's not. I don't have that freedom. But to an intimately transmitted disease like HPV, forcing me to give it to a 10 or 11-year-old when they're not even supposed to legally have sex till they're 14. And this is the primary way it's transmitted. It's not the only way, but the primary way HPV is transmitted. It goes against my religious views, and I shouldn't be forced to have my child take it if I don't want to. It's not, if my child remains uninfected, sterile, they're not hurting anybody if they're not having sex. Only if they're having sex and they are infected and passing it on to other people. That's not the way I want to raise my kids, though.
And remember, though, that it takes years for that vaccine to become really effective. So you may be vaccinating someone 7th grade, but it may be several years before it really is as effective as it should be. And then you're in an age where you may have sexual activities or intimate contacts, which could result in the transmission of the disease. So, granted, there's certainly controversy on that, but it's been recommended that that's the age at which it's most effective and where it benefits the child and the community best.
Bruce, is there a number, a percentage of people who get vaccinated? You and I go in and get a polio shot, and out of 100 people, is there a percentage of people who don't react at all? They don't get, their immune system doesn't change. They got them.
Most vaccines are at least 85% effective, and some, like measles, MMR is more like 98% effective. So they wouldn't be recommended if they weren't effective.
No, I'm not saying
and that's about how effective they are. It's true, some people can even after the vaccine can become infected. Shingles is one of the best ones. I had shingles. they had to change the formulation for shingles. Now, it's for older people like us, we are at high risk of shingles, and they have a new suite of vaccines for shingles that they didn't have 3 or 4 years ago. I had the old one, I got shingles. Now they give you a new version of the shingles shot, and it's much more effective. And by the way, I went back and got the other one. After having shingles, I can guarantee you, Bob, you will get that vaccine.
Bruce, you keep dragging me to the Social Security office.
I want to give you a chance to address the one sentence in here, though, that this could result in children becoming sterile. That's one. And then also to answer, another caller said that a caller heard that if a girl is exposed to HPV virus, then vaccinated, she is 45% more likely to get cervical cancer. Why are girls not tested before being given the vaccine? First of all, is that true on both accounts?
So no, that's true about being sterile. I mean, I mentioned about Australia. So if they were being vaccinated since 2009, then we will have all these Australians being sterile, I think. So that's false. And what was the second
The second one is the caller heard that when a girl is exposed to HPV and then vaccinated, she's more likely to get cervical cancer.
No, the whole purpose of the vaccine is to prevent cervical cancer. So if she already has a strain of HPV and you give her the vaccine, first of all, you don't really know what kind of, how do you know she has HPV? So that's why it's best to give it at that age. And so it's best to do that, and the shot is you can get it until you're 45 too. So I think, like for me, and I've had an auntie who passed away from cervical cancer, so I'm way past the age of the threshold of 45. So I'm thinking, like, I wish I had that opportunity to get that shot, because I'm not sure if I'll ever have that strain of HPV. So I think now women also have the opportunity to get that shot, not just the young women, but males are the main carriers of HPV. So it's good to just vaccinate all our sons and daughters. Yeah.
I don't know of any vaccine out there where if you've had the disease and you get the vaccine, there's a worse outcome. Flu is probably the best example, but there's none that I can think of. What I know of none where say you have the measles and you get a measles vaccine, that can only help in further developing your immunity to whatever you're being vaccinated for, and that's typically the case.
Another caller's calling in wanting to know about the requirements and the exemptions, obviously for all schools, including college, as you said, but what about homeschool groups? How is that enforced?
Well, the law applies to all public and private schools and universities, by the way. There are vaccine requirements for university-age secondary schools. But I honestly don't know how homeschool individuals are, how that's enforced. I believe they do have the same requirements, but obviously it's more difficult to enforce those requirements among homeschool individuals. And by the way, it's also the case with some of the charter schools and other places where they're not carefully monitoring the vaccine schedules that are being submitted by the students or parents. That's often the reason why you see that in some of those schools, is they're simply not following up and assuring that their students are being vaccinated. It's something we're working on and wanting to get together a good registry so that we can keep track and let school officials know, when there is a problem and the vaccine rates are dropping, that they better make sure that their kids are getting vaccinated.
This one is posed to you, and I think I know the answer, but it says, Chris via email says, do you want your sons to give their future wives the HPV virus and cause them cervical cancer? Obviously not.
Of course not.
But your opposition is really one.
It's mandating parents, the state coming in and mandating the parents give this vaccine to the kids at 10 years old. That's what I'm against. You can encourage it. Bruce can go out and engage in an education program with state funds and tell everybody, with Mary Rose, go out and educate the parents and say, this is a good thing, you need to do it. But when you mandate it, because it's almost an optional, if you don't have it, you're not going to, get it unless you're in intimate contact with someone who does have it, and it's usually sexual transmission. That's at least what I know. These guys have studied this a lot more than I have, and there's 100 strains. I didn't know there were 100 strains. But no, of course not. That was a sarcastic question.
You know, the mandate is actually, again, in keeping with that spirit of you're not only protecting yourself, you're protecting others. The reason it's mandated is because you want to be sure that people, that your sons and daughters aren't infecting other people as well as worrying about your son and daughter. So that's the reason why we mandate all vaccines, is because you're assuring that the community at large has a vaccine prevalence rate that prevents the introduction and spread of a disease in that community. So it's protecting the community as a whole that the mandate's essential. It's not just that one child. If it was a child in isolation, I would agree with it. It could be perhaps even argued that it was a personal choice, but in this case, you're not only just protecting that child, you're protecting others. And I think that's important to remember.
Can I ask you a question, Rep?
Yes.
Dermot? So we're mandating the HPV vaccine for 7th graders, but we're also mandating Tdap and meningococcal. So what do you think
What
about
is meningococcal?
Meningitis?
Okay.
So what do you think about
What is
those
Tdap?
mandates? Tdap is pertussis.
Pertussis.
Tetanus,
I don't even
diphtheria,
know.
and pertussis. So the whooping cough.
Okay.
So if there's a whooping cough and meningitis, that's also being mandated at the same time as the HPV vaccine at the 7th grade. What do you think about those?
But they're already getting those at early ages, right? As part of like a voluntary protocol, right? The diphtheria.
The diphtheria.
Right, we're getting that like first year birth, right? Very early
there's
on.
there's a strain of it, but then there's for meningitis. This is
We get several shots of that too, don't we?
no. This is only at the adolescent platform, the same as the HPV vaccine.
Yeah, I don't even know what meningitis is, so I mean, I don't mean to display my ignorance, but I'm not a
Oh no,
medical
It's
professional.
I mean, but if
But this one's controversial because it deals with sex, and it deals with the whole sexual revolution. And like I said, you said you were down there. I didn't see you. I'm sure you were. But the people who were pushing it was Planned Parenthood, LBGT Caucus, the Democratic Party, and all these guys. And the whole thing is more sex, more sex, more sex. Remove every barrier, every precaution. And they would never tell the kids what HPV was until I dug into Pono Choice. I thought it was genital warts. And I wish I would have brushed up on my research on it. But if they told young people that you got this through being promiscuous sexually, a lot more people would say, whoa, wait a minute. If you told the girls you could get it, even if your partner has a condom, you can still get HPV, I'm sure they would be much more prudent in their behavior. I'm not blaming girls, or boys.
Lyra, do you think that's true? Do you think that if that information was given to students, it would change their behavior?
Well, definitely comes back to my personal experience. I didn't really ask my kids, like my friends, oh, did you get the HPV vaccine? Oh, are you sexually active right now? No. My personal experience is I got the shot and my parents taught me. And it just comes down to that parental connection. If you are going to have that conversation with your child to tell them, hey, let's not engage in sexual activity, then I think that's important. And going back to the topic of it being mandatory, I wrote an anti-vaccination editorial, and I was saying that we shouldn't be ignorant to these types of problems and that we should push for those vaccinations. And the reason is because, yeah, we are in a society. And going back to the topics of herd immunity, I feel that because we are part of a society, it's our job to take care of everybody else. And so I support the doctor's stance that you're not just protecting yourself, you're protecting everybody else. So that's kind of my students' perspective.
So Lyra, why did your parents choose to vaccinate you?
First of all, they understood that it was a requirement. They wanted me to be as healthy as possible, and they want to prevent as much diseases as possible. And so that's why they gave me the vaccine. But they also made sure that they told me, hey, this is what this is for. I even got the paper explaining, oh, this is what it is. Here's the side effects. Here's, the statistics of, oh, this is how much it affects, or the percentages of how bad, the side effects can get. And so just reading that, because I was reading it while I was trying not to cry when I got the vaccine, I feel that was really informational for me. So I feel that pushing that information, because I don't feel that we don't know what HPV virus is. I feel that it's just we get the paper and there's just people that throw it away. It's just that ignorance topic that comes into question.
Well, on that topic, someone from Hawaiʻi Island says, please inform viewers that HPV exposure may increase your risk to vaginal, cervical, rectal, anal, and also head and neck. lung and gastric cancers because of increase of oral sex. HPV vaccine should be mandatory. That's according to this viewer on Hawaii Island. I'm interested in knowing when we talk the vaccine, if you don't get the vaccine and you are exposed to HPV, what is the outcome? How likely are you to get cancer?
So I think, like I mentioned before, 80% of the population was exposed to HPV. It's innocuous, right? So some people can get rid of the virus easily. Healthy people can do that, but some people can't. And that's when they get the infection, and it gets repeated of infection. And then when they have the infection, they're transmitting the virus to other people. And so then it turns into oral cancer, cervical cancer, penile cancer. And a good example of oral cancer is Michael Douglas. So he spoke out about HPV, and he said he had to go through chemo, and it was through oral sex. And that's how he got that strain of HPV. So I think even now, dentists are seeing more genital warts in the mouth and lesions, and are trying to also talk to patients about, hey, I noticed this, or talking to parents about, thinking of getting the HPV vaccine so that there is no problems in the future, or, they don't get the oral cancer that they're seeing more and more of now.
I don't know if it's been mentioned, but the sort of the policy or the philosophy behind vaccines is you give the vaccines as early as you can in life. The MMR, measles, mumps, and rubella vaccine is given at a very early age because young kids get those diseases. And if you're not vaccinated, you can get those diseases. Mumps is still a serious problem. We have thousands of cases of mumps. We've seen what happened with measles, and rubella, German measles, is also a very serious problem that's prevented only because people are vaccinated. So the whole idea is you get vaccinated early. Getting vaccinated for HPV at 7th grade doesn't mean that we're saying you should be having sex in 7th grade and 8th grade. You're vaccinating someone for the rest of their life, so that when they're in their early 20s, when most people are sexually active, then you're covered, and you're covered all the way up until then. It's not, the thinking isn't, oh, it's okay to do this, in 7th and 8th grades. Most people would agree that it's probably not. And the reality is, when you get into high school and you're in your 12th grade and getting out of school, you are probably going to be in situations where you would want to be vaccinated, and that's just the way it is. So I think I don't see it as promoting promiscuity. It's really getting prepared for later in life, just as it is with all those other vaccines. Those vaccines carry on for most of your life. In fact, all of them do, in theory, carry on. Hepatitis, all those others give you lifelong immunity to diseases. Sometimes the immunity does wear off in time. There's good studies that show that revaccination may be appropriate for some of those. But again, the whole idea is you get vaccinated as soon as you can, and it does provide for protection for your life. It doesn't mean that you want to be exposed to measles at early on. It just means that you should be protected early on for that condition. We
have just 3 minutes left, so I want to give you an opportunity to respond to that concern.
Geez, I'm speechless. I admire Bruce. I think he does a fantastic job for the state. I think Mary Rose is a bright young star we have. Really nice to meet you too, Lyra. This is a different philosophy. I came in on the philosophical thing of mandating, and I see the rights of parents being chipped away every day, every session down there. And this is another thing, another issue where it is related to parental child consent, raising your children. They have medical reasons why they want to do it. I understand that, but I just think parents should have the decision. We chose to do it, despite what Chris said. I said that my kids were vaccinated, so and they wouldn't have sex with Chris anyway. But but it's a parent's choice, a family's choice, I think, on this one in particular.
Okay, and Lyra, as a student, I want to give you the last word tonight. Why is this important?
I feel that mandatory is actually giving a negative connotation. I don't think it's more so, bad thing that it's mandatory. I see it as a good thing that the government is enforcing that, hey, this is a big virus that's affecting millions of people and millions of Americans, and if they can prevent that from happening, it's a good thing for the government, and it's a good thing for the people that are living in America. So I feel that as a student and as someone that did get the vaccine, I think that, you know, I'm safe for the vaccine. That's all that matters, and everybody else that did get that vaccine, and the more people that do, the more we decrease the risk of having that HPV vaccine. So I feel that's important.
Okay, and we'll leave it there. Thank you to all of you for joining us tonight. We thank our guests, Bruce Anderson, Hawaii State Health Director, May Rose de la Cruz, Assistant Researcher at the Office of Public Health Studies at the University of Hawaii, State Representative Bob McDermott from EVA on Oahu, and Lyra Panarigan, Senior at Moanalua High School. Next week on Insights, a problem that just won't go away, we are talking about the difficult issue of domestic violence. There's a lot to talk about on this, and we do hope that you will join us then. I'm Yanji Denise for Insights on PBS Hawaii. Until next time, aloha.